I'm Dr. Carolyn Harper. I'm the Director of Public Health in Northern Ireland, and as part of my role I produce a report each year on the health of people in Northern Ireland, and in this report I've highlighted the main public health challenges in Northern Ireland. I've given a flavour of some of the projects and actions that we've taken to address those challenges, and I've also highlighted the priorities for the year ahead. The main message in my report is that certainly we've made progress in a number of areas, but there's still more to do. We've seen, for example, over the last 10 years, a 25 to 35% decrease in the main causes of death in Northern Ireland: heart disease, cancer, respiratory disease, stroke, and so on. We've also seen life expectancy increase overall, and a typical man can now expect to live until they're 76, and a woman on average till they're 81. We've also seen good uptake from some of our newer public health programs. So, for example, the HPV vaccine, which is the vaccine which helps prevent cervical cancer, our uptake rates here are higher than in the UK, at around 84% here compared to 81% elsewhere. I think the single biggest improvement that we could make to the health of people here is to further reduce our smoking rates. While our rates have come down to around 24% on average, that compares to much lower rates elsewhere, particularly in Australia, for example, where the rate is around 20%, and California, where the rate is around 13%. So at the moment in Northern Ireland, we have around 2,400 smoking-related deaths each year. Those deaths are all avoidable. We have to do more to reduce our smoking rates. 6 out of 10 adults and 1 in 5 primary school children here is either overweight or obese. And there's increasing evidence that being overweight or obese is as bad for your health as smoking. Alcohol-related deaths in Northern Ireland over the last 30 years have trebled in men and doubled in women, not least because alcohol is much cheaper and more readily available than it ever has been. One of the key measures that the evidence would suggest works in reducing alcohol consumption is to introduce a minimum price per unit of alcohol, and I would very much call for and support that as a key action in driving down alcohol consumption within Northern Ireland. One of the remaining challenges, of course, is around health inequalities. The gap between the affluent and less affluent areas is not unique to Northern Ireland. Many countries, Western countries, see this inequalities gap. It is stubbornly resistant to change and to closing that gap. In Northern Ireland, it's most starkly evidenced by the difference in life expectancy. For men, there's a 4.4-year difference in life expectancy, and for women, a 2.6-year difference. In my report, I've highlighted 3 areas that would particularly bring benefits in terms of reducing health inequalities and improving health here. I've already mentioned reducing smoking rates. We also need to invest more in children, particularly in the first 5 years of life. There's good evidence that your experience in the first 5 years is a strong determinant and influence on what happens through the rest of your life, both in terms of educational attainment, job opportunities, and overall quality of life, as well as your health. And we'll be introducing a new programme to Northern Ireland that provides very intense support to vulnerable families in those first 2 years of life in particular. Thirdly, we need to work with people at a local level and involve them in designing and implementing the kinds of programs that will help improve their own health and reduce the inequality gap. So, for example, we're looking at a program from France that reduces obesity rates in children and adults. It's shown some promising results. It's an example of the kind of program that we'll look to implement here through 2010 and beyond. Health really is everyone's issue, whether you're an employer in the private sector or whether you're a frontline member of staff in the health service. While we've made improvement, there is still more to be done, and working together we can really achieve improvements in the health of people in Northern Ireland.